Urinary incontinence is involuntary leakage of urine, is when we have loss of urine at an inappropriate time and place. There are many different types of urinary incontinence. The common ones that affect millions of women are stress urinary incontinence, which is the involuntary leakage of urine during activities such as exercising, coughing, sneezing, laughing, lifting weights, and in short, during physical exertion. This affects at least 10 to 20% of women. It is common after childbirth and with aging. Another type of urinary incontinence is urgency urinary incontinence, is urinary incontinence associated with urgency, which is a symptom of the overactive bladder syndrome. This is also very common and affects millions of women worldwide. Urinary incontinence itself is a symptom. So loss of urine, involuntary loss of urine, at a time which is inappropriate or inconvenient, is describes the symptom of urinary incontinence. It could be provoked by physical exertion, such as coughing, sneezing, moving, laughing, or by urgency. Sometimes urinary incontinence may occur without any provocation, without any trigger. Sometimes it could be provoked by the key in the door or by the by hearing running water in our environment. Sometimes it may not even be noticed when it happens and only be noted later on. Common causes of stress urinary incontinence include pregnancy and vaginal childbirth, obesity and overweight, chronic coughing, chronic weightlifting, constipation and straining, aging, as well as genetic factors with weakness of the collagen or disorders associated with genetic or collagen disease. Overactive bladder, on the other hand, urgency urinary incontinence, or simply urgency and frequency, can often be idiopathic, can often occur without a specific cause. Urinary incontinence can often be diagnosed by history itself, particularly overactive bladder and urgency incontinence can be diagnosed by a history and description of triggers and symptoms. Stress urinary incontinence can also be diagnosed by the history and by the question that the clinician will ask the woman. In some cases, there are specific tests. First of all, clinical examination and coughing during the examination or straining may reveal stress incontinence and loss of urine during the exertion, or during tests such as running a tap as a provocation. Some women may experience the symptom of urgency or even urgency incontinence during a clinical examination. There are also more invasive investigations, such as urodynamic investigations, which can reproduce these triggers and symptoms during a test. Risk factors for stress incontinence include chronic straining, such as during or with constipation, chronic weightlifting, chronic coughing, and being overweight or obese. For overactive bladder, urgency, frequency, and urinary urgency incontinence. Risk factors could include caffeinated drinks, increased fluid intake, fizzy drinks, or specific types of sweeteners, or acidic drinks such as citrus fruit juices and citrus fruits.